Hey friends, let's read about a really important occupation today. Remember, an occupation is a job. My occupation is I'm a teacher. So let's read about a really important occupation today, being a doctor. It's a really important job for some people to do so that all of us can stay healthy and strong and not get sick. So let's read about a doctor. This is called Busy People, and today's occupation is a doctor. All right, here we go. Doctor. When people are sick or hurt, Dr. Miranda helps them feel better. She works in a doctor's office. Good morning, doctor, says the receptionist. So that's the person who works in the doctor's office, who takes the phone calls, makes the appointments. You have lots of people to see today. It's going to be a busy day. Dr. Miranda's first patient has a swollen ankle. So that means swelling is something that happens when you bump or you hit something and it gets bigger and puffier because it's hurt. It could be a part of your body. It could be a bump on your head. Oh dear, Olivia, may I take a look? Asks Dr. Miranda gently. She feels Olivia's leg and ankle, asking her where it hurts the most. Dr. Miranda thinks Olivia needs an x-ray. She tells Olivia's mommy to take her to the hospital. So an x-ray is a picture that's taken of your bones inside your body. Just to check that nothing is broken, says Dr. Miranda. So Olivia's ankle is hurting and it's swollen. Dr. Miranda thinks we better make sure it's not broken. Next, Dr. Miranda gives twin babies their shots. So when you're little, you need to get shots that will help your body make sure that it doesn't get sick with certain things. Like if you get a flu shot, that shot teaches your body to not get the flu or to fight away flu germs. So when you're little, you get a lot of different shots so that your body learns how to fight germs. So look at these twin little babies. Look at this little guy. Oh, he does not want a shot, little guy. She also examines a boy with chickenpox. Chickenpox is something that kids used to get, but now there's a shot for it so that you don't get it anymore. Well, I had it when I was little. What happens is you get itchy spots all over your body. Well, luckily, now there's a shot for it, and kids don't get that anymore. All right, let's see what else Dr. Miranda does. She checks a pregnant woman's blood pressure. Pregnant means she has a baby in her belly. So she's checking her blood pressure to make sure all her blood is flowing through her body really good. And she listens to a man's chest with her stethoscope. I'm sure you guys have had had a doctor listen to your heart before using their stethoscope. That's how they hear your heart. It's been a very busy morning already. Now Dr. Miranda has to call some patients who are too sick to leave their home. She asks them questions and then decides how to help them. Dr. Miranda is about to eat lunch when the receptionist enters and says, "Can you see one more patient this morning, doctor?" Jimmy has just arrived at the doctor's office for an emergency appointment. His daddy explains that he has a cough and a high temperature. That means he has a fever. Dr. Miranda asks whether Jimmy has a rash or any other symptoms. Symptoms are things that are going wrong, like a cough or a rash or a stuffy nose or a headache or a tummy ache. Those are all your symptoms. "No, he's just been sleeping a lot today, haven't you, Jimmy?" his daddy asks. Oh, poor Jimmy is not feeling well. Dr. Miranda takes Jimmy's temperature with a thermometer. Then she looks in his ears with an otoscope. So she's giving him a full check to make sure, or to try to figure out what's wrong with Jimmy. "Say, ah," she tells Jimmy. Remember, just like Dr. Otto says to all of Kara's kangaroos. Remember in the Dr. Otto book? He says, "Say, ah." And he looks inside. She's looking inside of Jimmy's mouth. Then she looks at the back of his throat using a special stick, just like Dr. Otto did. Next, Dr. Miranda asks Jimmy to sit on the bed and take off his sweater. Dr. Miranda listens carefully to Jimmy's chest using a stethoscope. Sometimes if you have like a bad cough or like your chest is hurting, a doctor can hear that by using their stethoscope. She can hear like noise in your chest that tells her that maybe you have a bad cold that's kind of stuck in your chest. The stethoscope feels cold and it tickles. Dr. Miranda thinks Jimmy has a chest infection, so he's got a bad cold that's stuck in his chest. She writes him a prescription for some medicine and asks him to come back in a few days if he doesn't feel better. So a prescription is when a doctor writes down what medicine you need and you bring that to like CVS or Walgreens and they give you the medicine. You should feel well again very soon, she tells him, waving goodbye. Thank you, doctor, says Jimmy. Dr. Miranda checks her afternoon schedule with the receptionist. What a busy day it's been. Dr. Miranda just has to make one more call before she can go out for her lunch. What else does Dr. Miranda do? She might make a house call. That means she goes to someone's house if they're really having trouble leaving the house, if they're super sick. She sends people to the hospital if they need more care. She gives shots to keep people from getting sick. She gives people test results. Like if a doctor is giving you a blood test to see if your blood is looking healthy and good, she'll call you back and tell you if your blood is working properly and if you're nice and healthy. What does Dr. Miranda need? She needs a computer. She needs tongue depressors. Those are those sticks that you use to look in someone's mouth. She needs an otoscope to look in your ears, a thermometer to check to see if you have a fever. She needs a phone in case she needs to call people. She needs a prescription pad of paper to write down medicines that people need. And she needs a stethoscope. All important stuff that Dr. Miranda might need. Here are some other busy people that work with Dr. Miranda. We met her receptionist, the person who writes down all her appointments and takes all her phone calls. The pharmacist is the person who gives you the right medicine. So if Dr. Miranda writes on her prescription pad that you need a certain medicine, the pharmacist will give you that extra special medicine to make sure and be safe that you don't get the wrong one. Nurses help Dr. Miranda. Also, ambulance drivers, in case there's an emergency and someone needs to get to the hospital quick. You might need an ambulance driver. Friends, that's the end. So what do you think? Do you think maybe one day you would like to have an occupation of being a doctor? Think about it. Sounds like a great job where you would help a lot of people feel better. All right, keep thinking about occupations, friends, and maybe you might want to ask your mom or dad or grandma or grandpa or auntie and uncle what their occupation is if you didn't already know. It's fun to know what grown-ups do when they go to work. All right, see you later, friends. Bye.